Good evening, everybody, and a very warm welcome to our webinar this evening. I'm going to make a start with the webinar now. It's great to see so many of you already here, and we hope to have even more joining us. Certainly, we've had a good number of people registering interest. I'm going to be starting our webinar this evening. My name is Elizabeth Fitzpatrick. I'm Assistant Director for Education and Early Help for the London Borough of Merton, and I'll be chairing the webinar. And I'd like to introduce our four panelists who will be variously presenting and also answering questions for us this evening. So first of all, I'd like to introduce Dr. Andrew Murray, who is the chair of the NHS South West London CCG, our clinical commissioning group. Sedina Agama, who is the Associate Director for Medicines Optimisation, our Chief Pharmacist for the Merton NHS South West London CCG. We also have Nichola Kane, who is our Chief Nurse at Kingston Hospital, and also here on behalf of HRCH, which is our partner for delivering the vaccines in schools. Also, Una Dalton, who is the South West London Programme Director for COVID-19 and flu vaccinations, also from South West London CCG. Just a little bit of opening from me, if I may, before I hand over to colleagues to take us through the slides. This is very much an evening for us to hear your questions, so we should be very grateful if you could add your questions, and colleagues will be supporting us to answer those. Questions that we can't answer this evening, we will take away and follow up, and we will be publishing this webinar, which is being recorded, with those questions and answers on the CCG and Council websites. Next slide, please. Thank you. So just to sort of reiterate the aims of the session this evening, we really want to support you as parents and carers and people in our local communities around understanding the COVID-19 vaccination programme for children aged 12 to 15 years old. And as I said, to provide that opportunity for questions to be answered. Just to give you an overview of what we will be doing. In a moment, I'll be handing over to Nichola, Chief Nurse from Kingston Hospital, to give us an introduction and to talk through the school immunisation programme and the consent process. And then we'll be going to Sedina, Chief Pharmacist, to talk us through around vaccine and safety. So thanks, Nichola. I'll hand over to you now.
Thanks, Elizabeth, and welcome to everyone who's joined the call this evening. So I just wanted to give you a kind of brief introduction around why we're vaccinating younger people between the age of 12 and 15. So this decision was made in collaboration with the Joint Committee on Vaccination and also our Chief Medical Officers, who recommended this was the right thing to do for our 12 to 15-year-olds. The ultimate aim of vaccinating this group of younger people is to reduce outbreaks that occur within schools, but also to protect them from COVID-19 themselves and how serious they may be affected by the COVID-19 as well, and to protect their family and friends against the virus. It was thought that the best way to deliver this programme would to do it in a very similar way to other vaccination programmes are delivered, so using the school vaccination programme. And we do appreciate that there are population of children who are not maybe in school or who are in mental health settings, and we are currently looking at ways that we can deliver the vaccination to those younger people as well. Next slide, please. So this is actually a really big project that we're trying to roll out across the whole of London. And we have over 200 schools in South West London. And I'm really pleased to tell you that we have actually been in contact with all schools, and we all have a date agreed in all schools across South West London. So that's great. Some of you will already have received a letter from me with a consent form embedded in the documentation, and also a leaflet with some questions and answers about the vaccination. What we're really encouraging you to do is to complete the online consent form, which is within the letter, which asks you some questions around the younger person's health, and to submit that consent form 2 days before we go into the school to run the vaccination programme, so ideally 48 hours. If your child doesn't get, or your younger person doesn't get the vaccination through this route of the school vaccination, the offer won't go away, because we'll be continuing to extend our offer of how and when we can vaccinate. Next slide, please. So what we really hope with the consent process is this is something that's agreed between you and your younger person as something that they really want to do. So we're asking for that collaborative consent. We do require parental consent, and although some maturer students may wish to consent themselves, if they come to the vaccination team on the day that we're there in the school to vaccinate, we will have to contact parents for parental consent. And if we're unable to do that on the day that we're actually in the school, we will look to see how we can facilitate that younger person receiving the vaccine. Thank you.
Thank you very much, Nichola. So over now to Sedina.
Thank you, Elizabeth. So why is it important for the 12 to 15-year-olds to get vaccinated? Well, we know from the efficacy of other vaccines that when enough people get vaccinated, it's harder for the disease to spread to those who can't have the vaccine. And for the COVID vaccine, there are still patients that, for whatever reason, they clinically can't have the vaccine. The idea is that more people that are vaccinated, the more protection that we have as a population. And we know that getting vaccinated is just not about protecting ourselves. It's really important that we protect our family, our friends, our communities, and schools where there are lots of different people coming in and out. It is really, really important that as many people that are in that school environment are immunized. One thing that I get asked a lot is, well, what if I've already had COVID? But we do know that it's much safer for your immune system to learn to fight the illness through vaccination than it is from catching the actual disease. Research has shown that the vaccines do reduce the risk of getting seriously ill and from dying. And I think we're more and more seeing people who have had the vaccine that do get COVID, but actually they have it very, very mildly. And actually some people don't even notice at all that they have it. We know that young people are at risk of developing long COVID, and that comes in lots of different forms and can have long-term effects on the young person or the child's ability to go to school and to do all their everyday activities. So it's really important that they have protection from this virus. There is still a chance that you can spread COVID even after you've had the vaccine. So it's really important to follow the advice. Hands, face, space, fresh air is still important today as it was last year and earlier in the year. Can I have the next slide, please? Is it safe for under 17s to have COVID-19 vaccine, and what are the side effects? Well, millions of people across the world have had the COVID vaccination. For some of us as health and social care workers, we had the vaccine quite early on, where there wasn't as much information on the vaccine as there is today. But the one thing we know for sure is that all the vaccines that are used in the UK have gone through very strict tests to check that they are safe and that they're effective. And that has been done by our independent regulator, which is the MHRA here in the UK, but has also been looked at by other regulatory authorities across the world. The research and the data shows that the most common adverse effects following vaccination in children aged 12 to 17 are injection site pain, as they would have had for other vaccinations, fever and a headache. But all of these reactions are generally mild, self-limiting and short-lived, and typically last 1 to 2 days. There's a lot of real life data now, because all of us, when we've had our vaccine, all that information is collated and is being monitored. And there have been some very, very extremely rare reports of a condition called myocarditis, which is the inflammation of the heart, or pericarditis, which is the inflammation of the membrane around the heart. But all those reports have shown that these conditions are reversible and they don't leave the young person with any long-lasting effects. I think that's the last slide.
Sedina, thank you very much indeed. Okay, so we've got some questions in coming in, so thank you for those. We're going to try and sort of pull some of those together. Either colleagues will be answering them directly, or as I said, we'll pull some of them together and I'll ask some of the panelists to be able to answer those. So we've had a question about the effects of the vaccine on children's bodies, particularly given that they are still developing. Dr. Andrew Murray, could I come to you first on that one, please?
Yes, of course. Really good question. So we've been vaccinating children for many, many years against a range of different illnesses. So you'll remember that your children will have had the diphtheria and pertussis vaccines when they were little. They'll have had possibly the MMR vaccine. So we've got a long history of giving vaccines to younger people. There's been over 10 million doses of the COVID vaccine given to under 18s worldwide. Excuse me. And there haven't been any recorded instances of death or serious adverse events. So I'd feel very confident to give it to young children.
Thank you, Andrew. That's very helpful. We also have some questions around, can children have the vaccine in any other centre but schools? My son would prefer to have me with him on the day of the vaccine. Is there any other way other than doing it at school, where of course parents won't be accompanying their children? Nichola, could I come to you on that one, please?
Thank you. And again, that's a really good question. We are currently looking at how we can deliver the vaccine outside of school settings with complete recognition of this. Just having been able to support a younger person having it is really important. So that's one of the things that we have been working on, and we will be imminently being able to release some details around that.
Thanks, Nichola. Again, a number of parents and carers asking, what if their child isn't yet 12? So they're in year 7, but they won't be year 12, they won't be age 12 when the vaccination takes place in the school. So what will happen for those children? Will there be alternative provision for when they turn 12? Una, would that be something that you would be able to pick up?
I think that the process of vaccination is on the day that the team go into the school. It is children aged 12 and above that will be vaccinated. However, as Nick has just said, we are putting in place a process where we can vaccinate this cohort in other settings, including GP practices potentially with our primary care networks and at our mass vaccination sites. As you know, or you may be aware, we've got 5 of them across Southwest London. So there will be opportunities throughout the year as this goes on to pick up some children who are not aged 12 when the vaccination team go into the school.
Thanks, Una. So some questions around GILIC competence. So GILIC competence is about young people aged between 12 and 15 having that competence to make the decision themselves. Obviously, we are asking parents for consent here, but how will that be applied? Can I ask, can I come to Sedina maybe on that, please?
So the GILIC competence relates to the consent that is given before the vaccination. And so the consent form is sent to the parent, and the idea is that the parent has a conversation with the child and they come to a conclusion together on what should happen about the vaccination. If there is a situation where a parent has a different view to the child, the idea is that there'll be a conversation with both the parent and the child. The GILIC competence is something that is used in healthcare generally to ascertain whether the child has enough information and has the ability to understand the information to make the consent. But I'm imagining that for this case, because the parent is going to have a discussion with the child, or there's going to be a discussion at a later date if they can't agree, that the GILIC competency wouldn't be the first thing that will be used. But I'm sure Nichola will explain what the process will be if we got to that situation where there is a difference in opinion, because ultimately it's got to be what is in the child's best interest.
Thank you, Sedina. Questions around the effects specifically on children who have special educational needs or have mental health concerns. Is there any research on the impact of the vaccine for this group of young people? Andrew, could I come to you, please?
Yeah, I'll start by answering that. Again, a really good question. The vaccine has been given to a whole range of different children. There is no known negative impact on people with mental health illness or learning difficulties. In fact, some of the children with the most severe learning difficulties actually fall into a higher risk group if they were to contract COVID infection itself. So they would benefit far more than those fully healthy 12 to 15-year-olds from vaccination. So we'd strongly recommend that.
Thank you, Andrew. The next question is around vaccine ingredients being suitable for those with severe allergies. Sedina, I think this one probably needs to come to you. Thank you.
Yes. So before a patient is immunized, they will be asked about their allergies, and we have all the ingredients in the vaccine. So we would go through the list of allergies with the patient, and if they've not indicated an allergy to any of the constituents of the vaccine, then we would go ahead and immunize them. If there's any doubt about the allergies, then we would have to check what those allergies are before they're immunized, or they may be offered an alternative. So we wouldn't give anybody the vaccine if from the information provided to us, there was an inkling that they may be allergic to something in the vaccine. And that has worked so far with the adults. We've had services that do immunize people where there is a question about the allergy, or where they know they're carrying an EpiPen because they have severe allergies or anaphylaxis. Then those patients will be referred into those special clinics to have their jab.
Thanks, Sedina. So the next question I'm coming to is, there have been questions around the impact of the vaccination on fertility. Is that something that we need to be worried about? Is there any evidence of an impact on fertility? Nichola, could I come to you, please?
I'm probably not the best one for that one. I was going to defer to Andrew.
Okay, Andrew, thank you.
Well, what I would say is there is no evidence of impact on fertility. And when you look at the vaccine, there's no logical reason why it should impact on fertility or the menstrual cycle.
Thank you. Okay, thank you very much. Just trying to scroll through the questions. Apologies. Thank you. Sorry, I'm just looking through. Can we be sure the vaccine is safe for 12 to 15-year-olds, bearing in mind that the JCVI did not feel able to endorse such vaccinations for that age group due to a lack of data? That's coming through from a number of people asking that question. So again, who is best placed? Andrew, thank you.
I will have a go. I mean, I think this is a really good question because it's a bit different for the 12 to 15-year-olds. I think the evidence was a bit different, and the JCVI had to have a really good look at it. And if you've looked at their conclusions, you will see that they concluded there was a marginal health benefit to individual 12 to 15-year-olds who didn't have an underlying health condition, so who weren't at underlying high risk from COVID. There's a marginal health benefit for healthy 12 to 15-year-olds. Of course, what they then passed on to the chief medical officer was that statement. What the chief medical officer considered was additional factors such as the risk of long COVID, which wasn't specifically considered by JCVI. They also considered the impact of children on missing time from school. They considered the wider impact on society of the benefits of vaccination in preventing the spread and preventing further disruption to schooling, but also the impact of passing coronavirus on to elderly relatives or to other people in society who might get very sick. So I think it's a really good question, but there's no doubt that the Chief Medical Officer's recommendation is absolutely right and makes a lot of sense.
Thank you, Andrew. Thank you, everybody, for your many questions which are coming in. We will do our best to try and answer them. As I said, moderators are trying to combine them and just trying to go through them all as we speak. So the next question is about, given that there is a low risk of COVID for children, in this age group compared, how does that stack up against the risk of unknown effects of the vaccine? So low risk of COVID for this age group, and then the unknown effects of the vaccine. Andrew, thank you again.
So I don't mean to hog, but I'll have a go, and then if other people have things to add, they can. I mean, again, these are really good questions. So there is a risk from COVID in this age group, but it's very low. So there is a risk of death, there is a risk of hospitalization, there's a risk of intensive care, there's a risk from long COVID or other complications of COVID. Those risks are low, and the risk from the vaccination is also very low, which is why the JCVI was balancing the relatively low risk in healthy 12 to 15-year-olds from having COVID with the very low risk from vaccination. Because if you do actually have COVID and you're very unlucky enough to get severely ill, the risk from that is death. The risk from a significant side effect from the vaccination, as I said, 10 million doses given worldwide, no deaths, no serious adverse effects. So on balance, you can see why they felt there was a marginal benefit from actually vaccinating 12 to 15-year-olds.
Thank you again, Andrew. And thank you for stepping up to the plate there whenever these questions are coming. So if your child has already had COVID, are there further benefits of getting the vaccine? Could I, Nichola, could I come to you, please? Would that be possible?
Sorry, I was having a moment there with the unmute button. Yes, we definitely are still recommending the vaccine to those children that have had COVID, because what we do know around vaccination, and Andrew talked a little bit about some of the vaccinations that are available, is that the immunity you get through the vaccination programme does actually strengthen your own natural immunity. And I don't know if Andrew wants to comment. Anything else he wants to add?
No, that's right. You'll get an enhanced immunity from having the vaccine, even if you've already had coronavirus.
Great, thank you very much, both of you. I think we've mentioned inflammation of the heart, but maybe Andrew, could you? Because there was a question a bit more about the inflammation of the heart and the risk of that.
Yeah, good question. Again, that's been in the news quite a bit. So inflammation of the heart, or in medical terms, myocarditis, it is a potential side effect of vaccination. But I think what you need to realise is it is also a side effect of having coronavirus infection, and those individuals who get inflammation of the heart following coronavirus infection, and the numbers are low, but that can be very serious and life-threatening. Very, very small numbers of individuals who've been vaccinated have also developed inflammation of the heart. But in those cases, the inflammation has been very mild and has resolved very quickly and has not resulted in long-term effects. So because of that, it's a very rare side effect, and the inflammation in the heart is very mild. When you balance that against the risks from coronavirus itself and the other benefits of having the vaccination to the children in terms of education and to wider society, you can see why the recommendation from the Chief Medical Officer in England and all the other nations in the UK is for 12 to 15-year-olds to have 1 dose of the vaccination.
Thanks again, Andrew. Again, to thank people for putting their questions into the chat. As those of you who can see the chat will understand, there is a lot coming in, so we are trying to make sure that we get through as many as possible. There's a question here about, there has been a short period of testing compared to normal vaccines. How do we know there are no longer term complications? Sedina, could I come to you on that one, please? Thank you.
Yeah, that's quite a common question that I get asked a lot as a pharmacist. So just a little bit about the background of the development of the COVID vaccine. The COVID vaccine came out at a time when the whole world needed a vaccine for COVID-19. And what was different about this vaccine was there was a lot of collaboration. So normally when a company is developing a product, be it a vaccine, be it a medicine, that company and that company alone develops the product. There's no sharing of information, and the company does all the research and brings it to the market. This time around, there was a lot of collaboration with the scientists. They were sharing the information about the virus as they received it. In the clinical trial phases, the information was shared, and instead of the clinical trials happening in sequential phasing, as soon as information was available, that information was shared with the next phase of the trial. So basically the process went through at a quicker rate than a normal product will be developed because of the sharing. There was also a lot of collaboration in terms of the regulatory authorities, and also lots of collaboration around the funding. So normally a company takes the risk financially for the product that they're developing, but this time round, the governments across the world backed the development of the vaccines. So this vaccine has had a very rigorous development and a lot of collaboration, far more than any other product that's been developed. And we can also already see that on the back of that, we now have a malaria vaccine, because we've learned that collaborating and doing things differently in the way that products that are needed across the world are developed does bring much better results. And that's what we've seen with the vaccine.
Thank you again, Sedina. So another question related to particular medical need. My son, this question asked, has cystic fibrosis and diabetes related to this. Is he okay to have the vaccine, and will he have just one dose? So who shall I come to on that one, please? Andrew, thank you.
I hope I can answer that, yeah. So both diabetes and cystic fibrosis would be considered to be risk factors for coronavirus, so that you're more likely to get significantly unwell with those underlying risk factors. So in children with those conditions, we would definitely be recommending vaccination, and the equivocal findings from the JCVI, where they weighed up the benefits of vaccination against the health benefits to children, that was for healthy 12 to 15-year-olds, where there was some debate. For those with an underlying health condition, really strong advice and evidence that you should have the vaccination, and it would be 2 doses rather than 1.
Thanks, Andrew.
Shall I just check that with my colleagues, Nick, as well?
Nick?
Yeah, that's absolutely right.
Okay, thank you both. So we've had a question around whether we should be looking more to the adults who've not yet been vaccinated. So the question is, should we not focus on the millions of adults who are not yet vaccinated in the UK before we move to this age group, given the risks of COVID versus risk of vaccine are similar in the age 12 to 15 age group? So should we perhaps be better focusing on those adults who have not yet been vaccinated? I'm just wondering, Una, whether I could come to you on that in terms of the broader vaccination programme, please?
Sure, yeah. We're trying very hard to ensure that we give equal priority to some of these, and we are absolutely putting a huge amount of effort and resources into making sure that the Evergreen offer is available to anybody who wants to be vaccinated. So we are at just shy of 70% of the South West London adult population for the first dose of vaccination, and about 64% for second doses. But our Evergreen offer is available to everybody. We're continuing with our efforts on communications and engaging with local communities. We're working very hard to try and have local pop-up vaccination centres where we know there are areas of low vaccination, so that we can keep this effort going. So we are trying to balance all of the priorities, but equally to look at increasing the numbers of adults in South West London that are vaccinated.
Thank you, Una.
Thanks.
Okay, so another around the risks of the potential risks of the vaccination. So there have been cases of blood clots when people have been vaccinated. What is the risk of this in younger recipients? So the risk of blood clots in younger recipients of the vaccine. Who shall I come to? Sedina, thank you.
Okay, yeah, so yes, there have been blood clots, and those blood clots have been observed in patients that had the AstraZeneca vaccine and under the age of 40. We're not using the AstraZeneca vaccine for our young people, so those patients are all having the Pfizer vaccine, and there hasn't been the level of blood clots seen in AstraZeneca patients in patients who've had the Pfizer vaccine. So there isn't a worry at the moment of there being blood clots in our younger patients.
Thank you, Sedina. So a number of questions I know around the fact that we've got COVID vaccinations happening this term, but also flu vaccinations, and wanting to understand, are there risks of having the COVID vaccine and the flu vaccine close together, knowing that's one of the questions I think which is on the consent form, and just trying to understand that a little bit better. Nichola, can I come to you, please?
Yes, so there isn't believed to be any risk of having both vaccinations actually on the same day, and the guidance around this just recently changed to say that you can give the flu and the COVID vaccination at the same time. But for some people that does feel just a little bit too much. So what we've done is we've offered schools the opportunity to do them separately, just because this is the initial phase of the rollout of this programme. But yes, it is safe to have both vaccinations.
Thank you, Nichola. So moving on, how does the vaccine protect others when you can pass COVID-19 on, even if you have been vaccinated? So how can the vaccine, or how does the vaccine protect others even when you can still pass it on? Andrew, could I come to you, please?
Sure. Good question again. So if you've been vaccinated, then your risk of catching COVID does go down. And if you, so therefore, if you don't catch it, you're less likely to pass it on. If you do catch coronavirus when you've had the vaccination, often you fight it off quicker and more effectively. You may have milder symptoms. And so because you're fighting off the virus, the level of virus in the blood is lower than it would be if you contracted coronavirus without vaccination, without antibodies. And that means that you're less likely to transmit it because there's lower levels of viral load in the body. So for those reasons, it does reduce transmission. It doesn't get rid of the risk of transmission. So you can still catch COVID and pass it on when you've had a vaccine, but it reduces the severity of the illness. And it, as I said, it reduces the likelihood of you passing it on.
Great. Thank you, Andrew. Okay, next question. So obviously in Merton schools, we've got children attending Merton schools who don't just live in Merton, but live outside the borough. So just trying to work out, does that affect how whether they will get the vaccine or not? Una, could I ask you that, please?
Yeah, I mean, the schools programme is running across the country. So wherever children are in school, they should be picked up in terms of the national programme. In addition, if for some reason a child who's going to school outside of Merton, if for any reason that school is not doing vaccination, we will ensure that there is alternative provision for parents to take their children to be vaccinated. We're hoping to have some of that up and running by half term. So that's the week after next, where we hope to have that alternative and additional provision. But generally, regardless of where your child goes to school, all children should be picked up by this schools programme, unless they're out of school, for example, being homeschooled. And we're working with the local authority on how we can ensure that we can pick up and get the invitation to that cohort of children, again, probably around half term. So particularly for those who are out of school, half term, there will be additional provision made available in Merton and across South West London.
Thanks, Una. We understand that for this age group, it is suggested that it is one dose of the vaccine, and wanting to understand why is only one dose of the vaccine recommended for this age group. Sedina, could I come to you on that one, please?
I think at the moment it's relating to the level of risk in this younger group. I think we've all seen that the actual number of cases are rising in this group. So for now, the guidance is to have one vaccine, but obviously we're watching what's going on, and the scientists are looking at the outcomes for children in this group. And so it's a matter of watch this space. But for now, 16 to 17 years are having one, and 12 to 15 are having one.
Okay, thanks, Sedina. A question from a parent who I'm sure this will be echoed by a number of people out there. My son panics when they see needles, really does not manage vaccinations or needles in any shape or form well. What can I do as a parent to support them? Nichola, could I come to you on that one?
Yeah, that's a good question, and it's actually quite a common issue. Just to be reassuring that the team that are actually going into the schools to deliver the vaccination are really, really experienced and skilled vaccination nurses. So would, you know, employ methods to reduce any anxiety or stress that may be caused, and adapt some different techniques. And we have actually allowed enough time in the programme to manage students who may have needle phobias, and as I say, they're very experienced at delivering vaccinations within the school setting. And as a parent, it's given the child or the younger person that reassurance that, you know, those factors would be taken into consideration. And what we would recommend is that the school inform the vaccination team so that those special precautions or measures could be implemented prior to the younger person having the vaccine.
Thanks, Nichola. And we're still getting some questions around those children who are not yet 12. So I know that I think we tried to answer that before, but Nichola, can I come back to you again on that one in terms of the children who aren't yet 12, what will happen for them, please?
So at the moment, the current guidance is for children aged 12 to 15, and it's quite strict around that age cohort, and is sticking to not vaccinating under the age of 12 at the moment in time. But as Una described, that we are opening more vaccination opportunities up, and the offer of vaccination is unlikely to go away. So as your child reaches the age of 12, then they would be able to access the vaccination. That is obviously subject to any change in guidance that may come out, but I'm not aware of any changes that are due to come out imminently. So at the moment it is just, we have to use that as our baseline, 12 to 15.
Thank you. Okay, so a question about the format in which the vaccine is delivered. So why is the vaccine not being administered in a spray or drops for children, as opposed to using needles? Sedina, can I come back to you on that one?
Yeah, so obviously at the moment, the vaccine was developed in the format that was the most stable, I guess, as stable as it can be. As an injection. Perhaps with time that will happen, it will come in other formats, but for now they needed a form that could be used universally, and that's why it comes as an injection. But like lots of other vaccines and other medications, different formulations come in due course. Okay,
thank you. So a question about, can a parent attend the school to support their child if they are very anxious? Una, could I come to you, please?
I think probably Nick is probably the best person to answer this in terms of questions, if that's okay.
Nick.
So at the moment, we aren't encouraging parents to come with their student, but obviously if there was exceptional circumstances, you know, and a particular reason why it was pertinent for the parent to be there, I'm sure that is something that we could consider. But what we want to do is, because of the volume of students being vaccinated, is not necessarily to have, you know, a large volume of parents coming along to the vaccination, but certainly the team are very flexible, and we want to do our best to ensure that we get this younger group vaccinated. So I'm sure if they let the head teacher know when there was exceptional circumstances, we could work around that.
Thanks, Nichola. So question around, so a young person who has turned 16 and had been given 2 doses of the vaccine. What is that okay? So we had been talking about single doses. Is that okay? Andrew, could I come to you, please?
Yes, it's fine. And there may be good reasons for giving 2 doses in under 18-year-olds. We talked before, if you happen to have particular risk factors that make you more susceptible to coronavirus, to get significantly ill if you get coronavirus, then it would be recommended that you have 2 doses. There's no harm in having 2 doses. But obviously the cohort we're talking about at the moment the recommendation is 1.
Thanks, Andrew. So I think we've got another question about allergies. So I think we answered, you know, whether it was going to be safe for a child to have vaccination if they have allergies. So the question is, if children with severe allergies are not going to be administered at school, is there any special vaccination sites available? And how do we know if they will be given the vaccine? So I can't remember who I came to before on allergies. Was that you, Sedina? Thank you.
I answered the allergies.
Yes.
Okay, so in relation to the allergies, the vaccinator would need to know what the patient is allergic to. So they will be asked, are you allergic to foods, medicines, any other vaccines? Do you carry an EpiPen? And then the vaccinator will make an assessment based on the allergies that they're communicated, whether or not it would be safe to give the vaccine. And that decision is based on what the patient has said they're allergic to versus what the contents of the vaccine are. I must say, I work hands-on in the vaccination clinic, and we have very few patients that actually are allergic to the vaccine. We do have a service where patients that have allergies can have their vaccination. So they have their vaccination where they are allergists around, and there's a sort of support for that patient. And it hasn't been an issue really in our clinics where a patient has been allergic and has been given the vaccine. So once the person says they have allergies, we will take a detailed history really of what the allergies are. And I believe the consent form also asks that question, so that on the day, the vaccinator will go through that patient's form and just make sure that the allergy situation is absolutely clear. If at any point there is a lack of clarity or we're not really sure about the specific allergen, the person won't be vaccinated until we can actually clarify that.
Thank you, Sedina. So this is going a little bit more widely in terms of vaccination for adults. So why are adults getting their third dose now, the booster dose? Andrew, please.
Well, there is some evidence that having had your first 2 doses of vaccine, after 6 months, the level of immunity can just start to slightly decrease. So the purpose of having the third dose, the booster, is to re-stimulate your immune system, to get your immunity back up, so that as we come into winter, and particularly for those who are most vulnerable, we've got the best possible immunization levels in the community. I've had my third dose because I'm a frontline health worker, and we're at the moment we're getting our most vulnerable patients in to have their third dose.
Thank you. So we've talked about proximity of COVID vaccination and flu. There is also now a question around COVID vaccinations and HPV vaccinations, which of course is another program for young people at school. So the question is, my daughter is due her second HPV injection soon, as this was delayed due to COVID. Will the HPV injection need to be delayed if my daughter receives the COVID vaccine? Nichola, please.
Thank you. No, there is no reason to delay the vaccination. You can have the COVID vaccination and the HPV vaccination, and actually it's really, really important that you continue to have those vaccinations. So yes, no, there's no delay.
Great. Thanks again. Okay, so we've heard a lot about digital passports, the COVID-19 digital passports. So do we know whether children will get a COVID-19 digital passport to be able to enable them to travel abroad if they have only had 1 dose? Andrew, can I ask if you know the answer to this? This one, maybe one I don't know, that we may need to sort of come back to later.
You can ask me if I know the answer to it, and the answer is no, I'm not sure. Una, do you know?
Well, I believe that 1 dose is fully vaccinated, and I believe that's the requirement for the COVID pass. So my understanding is, yes, they will, but I think we could take that away and just check the latest on it and confirm with the recording of the webinar. Great,
thank you. And yes, we'll get that out. Just want to check, Sedina and Nichola, you didn't want to come in on that one.
No, I don't actually know about the vaccine passport for children, but if for children that age 1 dose is at the moment the full course, then I haven't got any reason to believe that wouldn't be the case, but we would need to check that out.
Okay, thank you. A parent has been asking if they have got concerns about the vaccination. Is there anybody that they could talk to, particularly if their child has particular needs? Is there anybody that they would be able to talk this through? Nichola, that feels as if it could be one for you, please.
Yes, definitely. On the letter that the parents you'll receive, there is actually an email address for parents. So if you email that address and leave your contact details, you will get called by one of the team, and they'll be more than happy to go through any specific information that you require, or anything that you want to share with them in advance of going into school. So you can contact via that route.
Okay, thanks, Nichola. That's really reassuring. So a question from a parent or carer about their children having had COVID last week. How long do they need to wait until they can be vaccinated? Sedina, please. See you
I'll just
nodding.
put that in the chat. So it's 28 days from the date of the positive COVID test.
Great, thank you. And sorry, I'm trying to keep up with the questions and the answers.
And also to say to anybody who's got questions, you can also pop into any of our local vaccination service. If you've got any questions about the vaccine or any anxieties or whatever, any of us in any of the clinics are always more than happy to talk to you about it. So we might not be able to immunize your child there, but at least we can answer the questions for you and help you.
Thank you, Sedina. Again, very reassuring and helpful. Just another question about myocarditis. Andrew, if I can just bring this back to you, if I may. If this rare reaction should take place, how quickly would it present itself?
Good question. It would just depend on how severe the reaction is. So if it were a reaction after the COVID vaccination, that tends to be very mild, and so you may not even notice. But it is, I guess, it's likely to be days after the vaccination. I'd have to, if you want real specifics on that, I'd have to kind of go away and find out, and we could give you a more comprehensive answer to that. I mean, certainly if you get myocarditis in the context of having COVID infection, that tends to be much more severe, and you'd really know about it because you'd probably be hospitalized. I don't know if anyone else can answer about myocarditis following immunization. Sedina, do you know?
Yeah, I mean, not necessarily myocarditis specifically, but one thing we have learned about vaccines, and obviously we've been using vaccines for a very long time, is that if there are going to be any side effects, they tend to happen quite quickly. So, and that gives us the confidence about the vaccines, because any side effects that are going to be seen, you will see, very, very quickly. You don't tend to see them years later. They tend to be, within months or weeks of having the vaccine. So we need to look at the myocarditis to see what the case reports are saying. But they tend to be, quite soon, the side effects.
Okay, thank you. Just had a question from one parent. Could we just clarify exactly which vaccine children are going to be getting? And I think, Sedina, I think I heard you say that it's the Pfizer. The Pfizer is the vaccine, which will be given to children. We've had some more questions about who parents can talk to, and I think we've had some really helpful suggestions there from Nichola in terms of contacts on the consent form, and Sedina also saying absolutely people in the vaccination clinics are also very happy to take questions. A question here, an interesting one. Who is responsible for the programme? A fairly sort of to the point question. Una, could I ask you, please? Thank you.
Yeah, the NHS is responsible for the programme, and so we're rolling it out for sure.
Okay, thank you. So there's a question around, can we explain the process of how a child is supported after the vaccine in the school? So Nichola, I think that's one for you, please.
So we're providing the same support that we would do for any other vaccination programme that we'd run within the school. So the nurses, as I said, are very experienced around the vaccination programme, and then we would expect children just to return to normal after they've had their vaccination. And obviously, if there was any concerns, then the nursing team are there, but we would be just expecting the young adults to go back to whatever they were doing before they came for the vaccination.
There's a sort of a slight follow-up to that, Nichola. So adults were asked to wait for 15 minutes in terms of observation. Will children and young people be asked to wait for that period for observation afterwards?
That's a really good question, and I didn't cover it off earlier, but yes, they would be expected to wait the 15 minutes as well. So when we go into the schools, we do set up an area, which is a little waiting area where we've got a nurse who's overseeing that waiting area, and yes, the 15 minutes is the same.
Okay, thanks,
Thank you for
Nichola.
asking that. Thank you.
Thank you. And obviously it's ongoing concerns about the issue of myocarditis, and Andrew, we've had a number of questions asking us just to, I think, answer some more specifics here. And just what would we look for as parents in respect of a heart-related side effect? As parents, what would we be looking out for?
So it's such a very rare side effect. I would suggest that you're not looking out for it. But what you need to be aware of, if your child was to develop significant chest pain or tightness, significant breathlessness when they're exercising, difficulty in breathing at rest, abnormal heart rhythm, so their pulse is all over the place, those could potentially be symptoms of myocarditis, regardless of whether you've had the COVID vaccine or not. If a child gets those symptoms, you should take them very seriously anyway, because there's a range of possible causes for those symptoms, and you should, if your child's significantly unwell, you should be dialing 999, otherwise making sure that you see your GP urgently.
Thank you, Andrew. And I can see actually you've put some of those symptoms into the chat as well. That's really helpful. Thank you for multitasking, colleagues. So I just some more questions coming in really about children's anxieties on site, and I think probably just to again reassure parents that clinicians and nurses on site will be looking to try and as well as obviously school staff try to reassure children if they are anxious. But very specific one, Nichola, what if my child faints? Who will be responsible for that, and who will take care of them?
Oh. Well, I would hope that didn't happen, but if it did happen, the nursing team who are in the school would look after them, and obviously would make sure that they, got some time to recover from that, had a drink, and maybe a small snack as well, just to make sure that they're okay. But we certainly wouldn't return them to the classroom until that we knew that that they were all right. And as I say, these nurses are really, really experienced administering the vaccination to young adults and children, so they would take all the necessary precautions, but we'd certainly look after your child, definitely.
Okay, thank you, Nichola. Again, that's very reassuring. So a question around the dosage level within the vaccine for children. Will the dosage be the same for children as it has been for adults? Sedina, could I ask you that question, please?
The dose for the 12 to 15-year-olds, as far as I'm aware, yes, it is the same. It is the same dose as adults have had. Great,
thank you very much. Sorry, still trying to just manage questions. There is one here. I will just ask because a little bit of light relief. My daughter wants to know if she will get a sticker. Nichola, will they get a sticker like we got as adults saying I've received my COVID vaccination?
That's a really good question, and I'm absolutely ashamed to say I don't know the answer to that, but I certainly will be checking with the vaccination team tomorrow, because I think that's a brilliant thing to do. So I'll certainly be getting some stickers if we don't have them already. So thank you very, very much for that. That sounds like a really good question. Thank you.
It's just a moment there of a little bit more liberty, but obviously some very serious questions coming in. So I think just some further clarity. Could my child have the vaccine done in one of the vaccination clinics instead of at school? So I think we've looked at this from a certain dimension, but perhaps we could come back to that. Una.
So at the moment, the vaccination is only available in schools, but by the time we get to half term, in the next 2 weeks, we will have alternative provision across Southwest London that we will be making available, and that will probably be in the mass vaccination sites and some of our larger primary care GP sites. So today, no, but very soon over the course of the next 2 weeks, we will be able to do that.
Thank you. Again, just wanting to look down some of the questions and see if we are looking at some other common themes. apologies, just bear with me 1 second, please. Okay, looking down towards the bottom. Sorry, as you will be aware, there are lots of things coming in here, and you can possibly even hear me scrolling down as I look for further questions. It's just again on the light-hearted point. Some children have received badges instead of stickers in other boroughs, so we can look at that. Okay, I'm just wondering whether there are colleagues in the moderators are not presenting me with some other sort of common questions. And I'm just going to check in if others can see any others that I am missing, but we're heading towards 5 to 7. Una.
Yeah, there was a question about rollout and the timescale just a wee while back. So maybe just to pick up on that, to say that we have now started the rollout of the programme. We're starting quite slow, but as of next week, we're increasing the numbers of schools across Merton and South West London to about 5 schools per day. So we will really begin to ramp up over the coming weeks. Our overall aim is to complete this first round of all schools by the end of November at the latest. But at the same time, we're going to try and develop a mop-up service for those children who are unable to attend because maybe they have had COVID. We will start to publicise how we will do that in the next 2 weeks. So overall, ideally to complete by the end of November, but we will make alternative provision available in the next few weeks as well.
Thank you. And I think possibly also we've tried to maybe address this, but again, maybe coming from a slightly different angle. What is the research in relation to the menstrual cycle? I'm worried about the long-term effects on our young women in terms of the vaccine. Andrew, could I come to you on that one, please?
Yeah, as I said before, not aware of any impact on the menstrual cycle in young people, and there's no logical reason why the vaccine should do that. Okay.
Thank you, Andrew. We have a question around vaccinations having been.
Sorry, should I just? I've been trying to answer a couple of the questions in the chat as well, relating to things I said before. So I'm not sure everyone's had a chance to read that because I think that similar questions keep coming in. Should I just reiterate what I'd said? There was a question about because I said no recorded deaths from 10 million vaccinations in under 18-year-olds worldwide, and that is true. So no recorded deaths, no adverse events, no severe adverse events recorded in 10 million vaccinations of under 18s. Obviously, you will, if you look online, the stuff you're looking at online is relating to recorded deaths across the whole range of people in the world who've been vaccinated at any age, and it also records deaths that are not necessarily due to the vaccination itself. And there was a question about myocarditis. I said I'd clarify that. It is within a few days of vaccination. It's much less common after 1 dose than after 2 doses.
Okay, thank you, Andrew, for that. Those clarifications. It is difficult to keep track of where we might have answered in the chat previously, so that's very helpful. Maybe just a couple more questions. My child has already had her Pfizer vaccine abroad. I have passed the information to our GP in the school. Is this enough in terms of presumably suggesting that they don't need one here in this country? Nichola, I think this is a consent question. I'm presuming that the parent would be able to simply send through the form which would say, no, my child does not need the vaccination because they have had it abroad.
And just to add, the data system that we use to record that and people would have access to, so if we were to look up the child and we would see that they had 1 dose once we'd had that information from the parents, so we can enter that in.
Okay, thank you very much. Thank you everybody. for your questions. I'm going to take the opportunity now to thank the panelists for answering questions. We have noted obviously questions within the chat. We have said that we will try to, through a Q&A process, to share answers to those as we publish the video of this webinar, and we'll attempt to answer those questions alongside. Thank you for attending, parents and carers. Your contributions have been very welcome, and I would just like to say that you are able to refer to the latest scientific guidance on the issue. We'll circulate links with the recording. This is in line with the guidance from the NHSE about handling. Okay, thank you very much. So thank you very much for all that you've done, panelists and contributors. I will now be ending the webinar. Thank you very much. Bye-bye.